Well, when we look at overweight, we can look at either how it develops or how we treat it. When we look at what makes children grow bigger, and the question would be, does eating a high GI diet make them gain weight over time? What we have to do is ask them for their dietary behavior and then follow them up for several years, which is not always that easy. And as you can imagine, as a result, it's not so easy to tackle out what really contributes to overweight in children. But there is evidence from some studies that a higher GI does actually contribute to weight gain, in particular gain around the waist, particularly in adolescent girls. And there's another study, that study comes from Australia, and there's another study that we have in Dortmund showing that when adolescents consume a diet that induces a higher insulin demand during puberty, that they will end up with a higher body fat percentage in young adulthood. But there's other studies that do not confirm that. So we have to say there's only a few cohort studies at the moment, and we're not sure. It's possible, there is some evidence out there, but it's too early to say, yes, we're sure. We're not sure like we're sure about sugar-sweetened beverages. There the evidence is better, what we call the evidence. But for example, for fiber or whole grain, we don't know as much either. So it's not so surprising that we're still learning on how GI contributes to the development of overweight. Now, in terms of treating overweight in children and adolescents, there are quite a few studies there that show that having a low GI diet is just as effective or perhaps a little bit better as a diet that reduces fat intake, which is the conventional approach. But still there, the benefit is small, but it's there. But I think it's more important to look beyond overweight, because there's also a result from these studies that the dietary GI reduction will affect insulin sensitivity in a beneficial way. So children will be less insulin resistant if they eat a low GI diet. And more recently, we could show in our cohort in the Donald study that adolescents, this is again observational evidence, if they eat a lower GI diet during puberty for several years, they will have a better insulin sensitivity and lower liver fat markers in young adulthood. So I think that's what we need to have in mind, that when we advise children now as children and adolescents, they will perhaps, the best benefit will come later in life. And in addition to that, childhood and adolescence is a period when children learn nutritional behavior. And we all know that what we ate when we were children are mostly things that we still like eating today. So it's never too early to start teaching children, so when they become older and they have a higher risk, they will then profit from a lower GI. Now, your second question was, is it difficult to follow a low GI diet? Now, we know from the observational studies, when we compare the children that manage to eat a lower GI diet and those who have a higher GI diet, that there are a few things that really they do different. So the children who manage to eat slightly lower GI diets, which is really necessary only to have these benefits, you don't need to have huge reduction in dietary GI. So what they do is they eat more fruits, they eat more milk and milk products, and they eat more pasta. And that in the sum, taking it together, results in them having a lower GI. Of course, when we look at how should we lower GI, we also need to look at the adverse foods. So we know a lot of the energy-dense and starchy foods like sweets and pastries and cakes, they have a relatively high GI. But they're also energy-dense and don't contribute many nutrients. So we should reduce the intake of these foods for other reasons as well. So reducing the GI fits in with other recommendations there. And then the last thing is probably that we should look at what is the largest contributor to the GI in the diet, and that's often a food like bread, for the European children, or breakfast cereals for the Anglo-Saxon countries. And there we need to look at what are alternatives that children like. So we shouldn't say that they shouldn't eat bread. We look at lower GI alternatives. Like if they like rye breads, that's good because they have a lower GI. Maybe we need to develop more foods that also suit children's preferences better. In terms of breakfast cereals, there are alternatives out there. And there's always the alternative if the children really want to eat the Cheerios or the high GI cereals, that you can mix them with oats and reduce the glycemic index in that simple way. That always depends a bit on who you're dealing with.